Okay, so let's switch on over to social determinants of health. When caring for a person with dementia, it's important to remember to consider each patient's background. Each patient and their dementia are unique. While social determinants can help sculpt a person's health into what it is up until the point of a dementia diagnosis, it can also help determine how poor or well they can function during their disease process. To see how social determinants of health affect the disease process, let's consider the following examples. For instance, we might ask the question, how might a patient's finances affect how you care for them? For instance, a patient may not have the means to pay for medications that help slow the progression of dementia. A patient and their family might not be able to afford care at a nursing home or have someone take off work to care for them. Including a social worker could help determine what can be done to meet the patient where they are at financially to help manage their dementia. Now we could look at social support. How might a patient's social support affect how their dementia progresses? Is the patient isolated from family or friends? This could worsen their dementia if they were a very social person prior to the disease progression. Access to healthcare. How might a patient's access to healthcare affect their disease process? Does the patient live in a rural area and have limited options to see a provider? A lot of times it's very hard to get a person with dementia to a doctor's appointment. Now, I have personal experience in this realm. I worked for a healthcare company called Bluestone Physician Services as an intern, and they had a model of care rooted in having a mobile team of providers to address the difficulty of coordinating and transporting patients with dementia, as well as physical and mental disabilities as well, people in group homes. It's just difficult getting them to appointments. So this healthcare model, they had healthcare teams of physicians, NPs, PAs, kind of their primary care team that came to them in a group home or a nursing facility to provide care. And that's sort of one of the way that they increased access to healthcare for patients with dementia. Obviously, that's not available everywhere, but that could be one thing to consider. Maybe getting a relative into some type of primary care that has the provider come to them instead of having to transport patient to the provider. Okay, and lastly, the environment. How might a patient's environment affect their dementia? This is huge. Does a patient's environment support or worsen their disease progression? Are there signs that point to the bathroom or where they could get a snack? Are both the radio and TV blaring while they're trying to eat dinner, as we discussed in class? The environment that a patient lives in with dementia can really make or break how they are able to best function on a daily basis.